Good evening, madam. Shall we start, sir?
Good evening, sir. Yeah.
So, very good evening to you all. Shri Kumarswami Mahavidyalaya Ausa, District Latur in Maharashtra State. It's organized a World Record Series 2. It's a daily webinar. Today, there is 289th day of the series, and the resource person for today's session is on dais, Honorable Dr. Vishmitha Poovamma KN Madam. So first of all, I welcome to you, Madam, for the dais. I welcome the chief organizer of the series and heartily welcome all those dear participants. The topic for today's presentation is navigating the world of pediatric physiotherapy. Now this topic, as I have mentioned, going to present Dr. Vishmitha ma'am. She is a physiotherapist serving at Dr. M.V. Shetty College of Physiotherapy at Mangalore, Karnataka. So with this brief introduction, now I request you, madam, please start your presentation on today's topic, navigating the world of pediatric physiotherapy. You are most welcome.
Thank you so much, Prashant sir, for your warm welcome. And thank you, Dr. Betkar sir, for this amazing opportunity that you have given me. So, like sir said, I'm a physiotherapist and currently pursuing my post-graduation in pediatric physiotherapy. Apart from that, I've done my diploma in early childhood care and education. And also, I'm a certified Reiki practitioner. So, talking about today's topic, why I chose it. So, when I tell people about my profession or the specialization that I'm doing, they're always in wonder. They always tell me that they never knew such specialization existed. So, I thought, what better platform than this to tell people, to create an awareness so that they can make a better, informed choice for their health of their kids. So that's how I chose this topic. So I'll start presenting if that is okay, sir. Yes. Yes, sir. Is this visible, sir? Give me a second, sir. Yes. So we'll start off with the introduction. So who is a pediatric physiotherapist? Pediatric physiotherapists are specialists in the assessment, identification, diagnosis, and treatment of disorders of movement and physiological issues. They treat children from their infancy to 19 years of age. So infancy 0 to 1 year old. So this is the introduction of who a pediatric physiotherapist is. Moving on next, goals of treatment. So the International Classification of Functioning Disability and Health, that is the ICF model, focuses on the classification of functioning and disability, particularly in relation to participation and activity performance. So we all follow this ICF model to make a tailored protocol for each of our patients. So this is achieved by addressing pain management, improving strength and endurance. Endurance is how much time does a muscle take to, get tired. Okay, 1 second. This is okay? Okay. So I was saying the ICF model. So this is achieved how we treat a patient, and what do we do is by addressing their pain management, improving strength and endurance, and providing opportunities for skill acquisition through learning. So here the word endurance means how long can a muscle work without getting tired. So even in sports personnel, we might have heard how we have to increase their endurance. So here the same thing: strength, endurance, pain management, and if the skill that naturally has to happen is not acquired, skill acquisition is also done. Second is by adopting family centered intervention and early diagnosis model, a pediatric physiotherapist will collaborate with a team that includes the family and other health professionals. So in children, as they grow at a very fast pace, what is important is early diagnosis of a treatment and whatever early diagnosis of the condition and the treatment. And here, inclusion of family is important. We have to clearly tell them what the child is going through, what the condition means, and what are the do's and don'ts in the disorder that they have. Hence, family and other professionals are also included. Moving on next. So there are n number of disorders that can be treated by physiotherapist, but for convenience, I've put the 10 most common ones here. Starting off with cerebral palsy. So cerebral palsy is a neurological condition. So there is tightness of a muscle, or sometimes there is flaccidity, or what is called the looseness of muscle can be present. So such conditions are treated. Second, we have torticollis. Torticollis means shortening of the neck. There is a contracture of the neck muscles, because of which the head of the baby or the child can be turned to one side. This can also be corrected. Third, we have sports injuries and orthopedic conditions. Coming to sports injuries, like commonly we see ankle sprains, ligament or meniscal injuries, fractures, muscle strains, all these commonly come under sports injuries. Next, we have orthopedic conditions. Orthopedic, commonly we see something called CTEV or club foot. Rickets, we know, deficiencies of vitamin D can cause. Then dysplasias, scoliosis. These are the common orthopedic conditions that we treat. Next, we have floppy or low tone muscle. Here, there is poor muscle buildup of muscle fibers, which can cause a very shaggy kind of muscle. So, the movement that has to be performed cannot be performed even with their will. So, that is floppy or low tone muscle. So, it is commonly seen in conditions like muscle dystrophy. Next up, we have coordination disorders. Here, the movements are very clumsy. They are able to do the movement. Muscle power is also there, but the movements are very clumsy. They have difficulty learning a new skill or task. So what we do is we help them reteach a movement, that if they're doing it in a wrong pattern, we reteach, or if they're not able to do at all, then a new skill acquisition is also taught. That is coordination disorders. Next up, we have toe walking. So this is commonly seen when there are contracture or tightness of the muscles or ligaments behind your leg. So that can be due to various reasons. Commonly, it is some neurological issue that is there. So what the child does is he'll start walking on the ball of the feet. So that will also be corrected. Next, we have Down syndrome. It is also known as trisomy 21. So it is quite common. We all have seen kids with it. So trisomy 21 is where there's an extra chromosome at the 21st pair. So because of that extra genetic material that is there, there can be intellectual disability, developmental delays. So these can be treated. Next, we have developmental delays. So what is this developmental milestones and what is the delay that can happen? Children follow a specific growth pattern. So if that slows or stops, then we call them developmental delays. I'll give you an example. Within first 2 months, baby should be able to turn their head on either side. Or if we take another example, by 9 to 11 months, he or she should be able to walk with support. So these are the few examples that I've given. So there's a list of them. So if within that period, if they're not able to do that movement, so then that has to be treated, that can be treated with physiotherapy. Next, we have preterm babies. So who are called preterm babies? They are the ones who are born before 37 weeks of gestation period. So we know all of the organs, muscles, all are not yet matured. They're all underdeveloped. So in them, we see cardiorespiratory issues a lot. For example, we can see respiratory distress syndrome, VSD, ventricular septal defects, and also post any surgeries done on them, those also can be treated with physiotherapy. Okay, those are the common pediatric impairments. Moving on. Okay, after the conditions, we'll see what are the types of pediatric physiotherapy. What are the subcategories that we have to be more specific? First is neonatal physiotherapy. So neonates are the babies that come under 28 days. So here it includes chest physiotherapy. So there are certain techniques like percussion, vibration that is given so that the phlegm or any secretion that is accumulated can be removed. If they're suffering from any respiratory issue, usually that's the case in neonates. Next, we have positioning. Since they're already premature, new positioning can be given for normal skeletal alignment to support their respiratory function, and it also prevents plagiocephaly, that is when there is an asymmetry in the skull. So all these positioning can help. Next, orofacial stimulation. Orofacial stimulation is done in children where breastfeeding is difficult. That means the baby is not able to suck the milk. So in such cases, orofacial stimulation is done to bring about the strengthening of their muscles. Next, we have passive movements and sensory motor stimulation. So since we already know that there will be a weakness in the muscles, they're underdeveloped basically. So passive movements, that the therapist will do certain movements that is in the normal range so that the flexibility of that joint is maintained, circulation is improved, and whatever negative effects can happen due to immobility. For example, the tightness of the joint can happen, or the muscle function can be lost eventually. There'll be muscle wasting. All that can be prevented if you do passive movements. And next is sensory motor stimulation. So we know our five senses. So there's a certain equipments or aids that we can use, such as rocker boards or balance shoes that can bring about certain movements. So that is about neonatal physiotherapy. Second is neurodevelopmental physiotherapy. So the techniques here aim to achieve gross motor milestones, improve balance and coordination, manage spasticity or flaccidity, etc. So here we already spoke about milestones. That is a certain pattern of development that happens in children. So in neurological cases, especially training gross motor, that means bigger muscle groups. For example, for them to walk, for them to jump, for them to run around. So such activities are concentrated more since they're, like we said, they're developing at a faster rate. Their growth is fast, so such milestones are taken. The opposite of this, the other one is fine motor movements, such as when the child has to write, he uses precise small muscle groups that will be fine motor. So here mainly gross motor milestones are achieved with the therapist. Balance and coordination, we know. Manage spasticity or flaccidity. Spasticity is tightness or contracture of a muscle, and flaccidity is the opposite. There's looseness of muscle. The movement that has to be done will not be possible. Okay. Moving on, we have orthopedic pediatric physiotherapy. So here it deals with children who have congenital deformities. Congenital deformities meaning birth defects that we say. Sports or any other injuries to their muscles or ligaments. So the name itself is quite common and well known, orthopedic. So those are the things that is treated under it. Next, we have cardiopulmonary pediatric physiotherapy. So the techniques include chest physiotherapy, positioning, breathing exercise, respiratory muscle strengthening, and energy conservation techniques. Chest physiotherapy, like I said, in preterm babies, certain percussion, vibrations, and certain techniques like that are used. Positioning, here we do auscultation, and then we see which part of the lungs or which lobe of a lung has the secretion. Depending on it, it is positioned in such a way that naturally the secretions of phlegm that is collected can, with the help of gravity, can come to the main bronchi for it to be taken out. Next.
Excuse me, madam.
Yes, sir.
If possible, you can use Hindi also, if it is possible.
Okay, Hindi, I'm not very good at it, but okay.
Yes. Okay, please continue, madam. Okay.
Breathing exercise. So, respiratory muscle training has to be given. If it is, for example, a preterm baby, they're already the respiratory muscles or muscles जो हम यूज करते हैं रेस्पिरेशन के लिए वो अंडर डेवलप्ड रहता है, तो उसे रीट्रेन किया जाता है ब्रीदिंग एक्सरसाइजेस से. देयर आर अगेन so many techniques of breathing that can be given depending on the condition of the baby. So that is strengthening of their muscle and energy conservation techniques. Okay. So those were the few classification. अब हम move करेंगे common treatment approaches and principles जो हम widely use करते हैं. The first one is the Bobath approach. It's a neurodevelopmental treatment method that aims to enhance developmental sequences, suppress abnormal patterns, promote normal postural control, and utilize sensory stimuli to either inhibit or activate muscle movement. So Bobath technique में क्या करते हैं, पहले तो जो नॉर्मल डेवलपमेंट सीक्वेंस होता है जैसे हमने पहले ही बात किया था, so we'll enhance it. If it's not happening normally, then those methods are enhanced. Then abnormal pattern, what a child does, if he wants to pick up a glass of water that's kept in front of him and is not able to do it because of certain problems, he'll do a trick movement. He might just bend himself up, a trick movement, not the usual way. He follows his own pattern to just accomplish that task. So that might become a habit. So to suppress that abnormal pattern is very important. Next, promote normal postural control and utilize sensory stimuli. हम sensory stimuli, external stimuli देते so that a certain activity that is needed might activate, certain muscles are activated, so indirectly a movement happens, और if that's an abnormal pattern और जो हमें नहीं चाहिए होता है उसको suppress करने के लिए. That was Bobath approach. Next, motor learning. So this can be advantageous in rehabilitation of infants who have been diagnosed with cerebral palsy. So here cerebral palsy मैंने इसलिए दिया है because वो quite common है, but any conditions where the child is not able to do a movement or so a motor learning means movement. So basically वो सब retrain करते हैं या उनको नया सिखाते हैं. So that is motor learning. Next, we have conducive education approach. Conducive education is an extremely strict treatment style that focuses on all elements of life. This is carried out by a conductor who constantly monitors the child's action. So individuals with neurological and mobility impairment consciously perform activities which otherwise is quite normal for other children. So according to their age, there is something that they must be able to do. If it is not done, if they are consciously taught to do that activity. So that is conducive education approach. Next, we have the Margaret Rood technique. This is quite common one. So this method employs both superficial and deep stimulation. So it can be any type of stimulation. The external stimulation is given and also certain manipulations are done to activate or inhibit motor function. Again, to suppress certain things or to activate the muscles. See, one muscle might be tight, the other might be loose. So then strengthening of one is required, stretching of the other is required. So it depends accordingly to the patient we do. Next, we have the temple fay technique. Here, sequential developing movement activates normal movement patterns. So what happens here is a normal movement pattern will be there. Example, first he has to crawl, then creep, then walk, and then run. So that normal pattern is done in a sequence, proper, perfect. The same sequence has to be done so that normal growth happens, and whatever activity they're not able to do, the muscle groups gets activated. That is temple fay technique. Next, we have the domain delecto approach. This technique facilitates the brain's dormant central nervous system pathways by employing consistent repeating motions of natural sequential development movement patterns. So here, so basically what they do here is there's a principle called flaccidity, neural plasticity. So here, if the child is not able to pick up the food and put it into its mouth, so this is a movement that has to happen. If this is not happening, that means the neural connections might not be there, or it might be in a dormant state. So what they do is repeating this movement can cause in the part of the brain where this movement has to happen, those neural pathways are created. New neural pathways can also be done. So this can also be seen in stroke patients, where they might have the muscle strength to do a certain movement, but it's like a disconnection that happens from the brain to that muscle, right? So they know how to perform, but they're not able to perform. So this neuronal connection or new neural pathways are created using this approach. Next, we have the Kabat-Cannot-Was technique. So here, functional movement patterns for proprioceptive neuromuscular stimulation. So here, something called PNF is used. So different reflexes, basically it works on the principle of reflex. For example, in a baby, there's something called the grasp reflex. If you just strike your finger onto the baby's palm, you see that they immediately clench their fist. That's called the grasp reflex. It's just an example, but there are many other reflexes that are present at certain age. So that reflexes can be used to bring about a normal movement. And even this grasp, now when we do, if anybody strikes, we won't clasp our fingers. So there's a specific age through which this grasp reflex has to be there. After which, even though it is normal reflex, after the certain age, if it is there, again we'll be considering it an abnormal reflex, which can be a sign of any other disorders. So such natural reflexes can also be used as a mode of treatment. Okay. Next off, we have urotherapy. So it is administered by a physiotherapist who specializes in continence disorders. These therapists specialize in the treatment of bowel and bladder problems using pelvic floor muscle training, neuromodulation, lifestyle adjustments, and behavioral modification. So we see so many children. There is even at least at the age of 36 months, they should have full control over their bowel and bladder. But even after that, if there is bedwetting or there's no bladder control, there's leaky urine, all those, that's the case, then it could mean that their pelvic floor muscles might be weak or any other issues can happen. So identifying that issue and then giving a strengthening program or any other technique can be given. And also I've mentioned here lifestyle adjustments and behavioral modification, because we also know behavior, they might be traumatized with something, or there might be emotional disturbance that happens, because of which also there can be leaky urine and all that. So identification of the cause becomes very important here. So that's about urotherapy. Next, we have the most common and loved one, that is the aquatic therapy. Aquatic therapy sessions takes place in water and combine enjoyment and therapy, naturally inspiring children to engage. Water, from a scientific standpoint, is great for cancelling gravity, which means that performing actions in water will be significantly easier than on land. Not just the gravity, based on gravity, but we see the compliance of children is a lot when it comes to aquatic therapy. Adults, any movement we ask them to do, they'll do. This many repetitions, they'll do. But when it comes to children, always a playway method must be employed, so that it's not, at the tender age, it's not like a therapy or a treatment or something that they don't want to do. So aquatic therapy solves all their problems. It is very joyful for them, as well as it does our work also. It is easier for them because inside water, it's easier to do the movement. It doesn't seem like a work or a treatment anymore. So now, nowadays, aquatic therapy is also gaining a lot of popularity. And there are many research papers also which has given enough evidence that it is a good treatment protocol for many conditions, like it may be CP or so many conditions. It has shown good evidence. So the last question is, where do pediatric physiotherapists work or where they treat? So pediatric physiotherapists are available in a wide variety of settings. First, we're talking about NICU, that is neonatal intensive care unit, and pediatric intensive care unit, PICU, usually in hospitals. Then second, we have outpatient settings, we call it OPD, right? Clinics, child health and development centers. Next, we have schools, that is special schools also. Nowadays, there are physiotherapists that are available, and sports clubs and other centers. So, yes, that's all. Thank you so much for taking time to attend this webinar. Just a minute.
Thank you so much, madam, for your wonderful presentation. Now it's time to be discussion with the participants. You are requested, dear participants, please, if you have any query, to discuss with madam, dear participants. Welcome, Dr. Swanand Shukla, sir, please.
Good evening, Dr. Bedkar sir, Principal sir, Prashant sir, and good evening, Doctor. A wonderful presentation you have made about the physiotherapy. And physiotherapy is an integral part of medicine nowadays. And now and then we require the help of a physiotherapist for various reasons. And especially you are doing master in your master or PG, post-graduation, I think you are doing in your pediatric physiotherapy. Wonderful thing you are doing. My two questions are there. The one is, if suppose there is some, is hello, am I audible?
Yes, sir. Yes. Yes.
Yeah. If suppose the children, especially the infants, they are coming with the complaints of a constipative tendency and they are not passing stool for 2 to 3 days. And for this reason, for respiratory system, cardio system, neuro, we are having all kind of physiotherapies. Is there any physiotherapy available for such a kind of complaints? That is the first question. And when we are talking about cerebral palsy, when there is a cerebral some problems, organic disorder is there. Is there means what kind of chances we get, for improvisation, because we are dealing with the neurons at one side and the muscles at one side. By giving physiotherapy, can we bring, can we at least they should work for themselves, can we bring to the daily activity to that child? These are my two questions. Thank you.
Madam, please.
Hello.
Yes, madam. Yes.
So there is a problem with my mic, so I'm just using another system. Is this audible now? Okay. Okay. Yeah. This is okay, no? First question I think was about constipation. Like I said, it can be due to tightness of any muscle that is there, or it can be, first of all, identifying what might be the cause is important. So, but when we talk about a physiotherapy perspective, if there is tightness due to anything, the relaxation techniques are there, relaxation of muscles can be done, and what we call pelvic floor muscle training can also be given. That can help with constipation. And next was cerebral palsy. Sir, can you repeat the second question? I was trying to fix the mic.
Yeah, my
Yes.
question. Like in cerebral palsy, there is an organic disorder of the brain. And if we try to give some physiotherapy to the extremities or some other part of the body, whether it really helps, because I'm having a good number of patients of such a kind, and even varus and valgus. So what we can do with such kind of patients? Thank you.
Okay. Cerebral palsy, we see there are many types. So each one has its own problem. For example, if we take spastic cerebral palsy, the muscles are very tight, because of which there is foot drop and conditions like that. So stretching, that is especially sustained stretching, is quite beneficial. We see a lot of improvement done directly going to surgery. So that is one. And when we come to flaccidity, stimulations, external stimulations or electrical stimulations, or persuading the child to whatever movement is possible, if we can improve it, the flaccidity can be reduced. Next, when there are certain other problems like balance, coordination issues, and like you said, varus valgus. Varus valgus, to a certain extent, we can help. That is, because of tightness of one muscle, there will be an extra pull to one side. It may either lateral side or medial side. So, identifying which group is affected, again, stretching, or if there is a strengthening required, accordingly, if we do, so to a certain extent, valgus and an early intervention is also required. The earlier, the better. The result will be better. And balance and coordination is the next important thing that we see in cerebral palsy. So there are very detailed and neatly prescribed exercise protocol for this balance and coordination that is already there, and the evidence has shown a good amount of progress. For example, even now I have a case of spastic CPA. They are very reluctant to go with surgery, any lengthening or procedures like that. And now her developmental delays has already come to a quite normal place. Like she's able to sit, she's able to stand. A little bit of walking is a problem. So we see a lot of changes or good progress that we see in her just with exercises. So that's what a good screening, what is wrong, and identifying early intervention is required. And that's what. Even for cerebral palsy, I think physiotherapy has become a must. Hope that helps.
Thank you very much, ma'am. And I know it is very difficult to manage pediatric patients. Even for just clinical examination, also they are not keeping quiet. Doing this physiotherapy, it is one of the very important tasks. So we have to be very clear with our psychomotor and affective domain. Thank you very much, ma'am.
Thank you so much, sir. Thank you for your questions.
Hello, good evening, ma'am. Am I audible?
Yes, sir, you are.
Yeah,
Yes, sir.
yeah. And today, many children are suffering from the behavior issues, like not only eating habits, like CBD behavior and focusing due to less focus, etc. And so, how can reduce the CBD behavior or the behavior issues? Saying a small query, right?
Okay, so for behavior management, to be more precise, there are people known as behavior therapists who can help. But physiotherapy perspective, identifying the cause, why there's a behavioral problem, because it can be due to any other disorder that they have. It might not just be the environment that is affecting, but neurologically, because now there's a lot of people are understanding what this autism is, or because it is not visibly seen. Like if we see Down syndrome, just looking at their features, parents are able to identify it. So, but when it comes to behavioral diseases like autism spectrum, there's a lot of awareness programs that are happening to identify it. But I think that's what. There are behavior therapists as well as any other medical professional will be able to identify if they come up with a problem. And I think they can guide them accordingly to other therapists or medical professionals if required.
Okay, thank you, ma'am.
Yes, sir.
Anybody else, dear participants? So thank you so much, Dr. Swanand Shukla sir and Vidyasagar sir, for clearing your queries from the keynote speaker, Honorable Vishmitha ma'am. Now I request the chief organizer of the series, Honorable Principal M. Ambedkar sir, for the concluding words. You are most welcome, sir.
Thank you, Prashant sir. All my staff members of my college, IQC coordinator Dr. Sanjay Kale sir, Chamuntra Kadam sir, Professor Ken Kadam sir, Anita Dhole madam, and respected Dr. Swanand Shukla sir, Praveen Utge sir, who is supervisor of our college, and then Vidyasagar sir, and the main person who helped me to introduce her, that is Radha madam, Radha Vallabh madam. I first of all thank you to her, because when we scheduled her speech, she in just discussion said that she will able to join here as a resource person. Can you permit her? I was very happy, because this dais always encourages to the those who are new in this field. They do want to some go ahead in academic field. They become dare to explain what they have the knowledge, research for the society. So it's the first step towards the contribution of knowledge to the society by you. Actually, physiotherapy is the subject related to our health, because when we treat from the doctor for any other surgery or any other treatment, then they recommend physiotherapy for the post part of that thing, if they are having some uh, treatment with the physiotherapy. So physiotherapists are the need of the our life. If we are not ill, but we need physiotherapist to keep our body parts well functioning. So what you have said, that most out of our imagination and thinking also, because you introduced so many new terms for us which are new for us also. So Prashant Ughade sir was saying that just use Hindi, but no problem, we will convert it by watching your TV, that YouTube link. I am thankful to Dr. Swanand Shukla sir. He is expert from the medicinal field, so that he may discuss scientifically with you, and he got answer also from the you. So your presentation was very perfect.
Thank
PPT
you
was
so
to
much.
the mark and to the best PPT, and explanation was so much basic and needful to all, because deep knowledge from physiotherapy was unexpected here, and simple knowledge, basic knowledge, useful knowledge, mostly related to pediatric problems. So you explained with a very perfect manner as the expert of this presentation. You are expert from your subject, no doubt, but in presentation, so we are thankful to you. And in future also, if you wish to join here as a resource person for new topic, if you want, then you are always welcome. I am thankful to Radha madam. Just we are going to listen her also on 22nd, I think. So within 2 years, mummy and her daughter will join here as a resource person. So thank you to both of you, and we wish all the best for your future career, to have more service to the society through your service, and through your post, and through your that. Thank you, madam.
Thank you so much, sir, for your appreciation. It means a lot to me. Thank you for your simplicity, and also Prashant sir, thank you very much. And all the participants who have taken so much of your valuable time to be here, and all the questions, hope I've answered them well. Thank you so much for joining.
Please stay here,
Thank
because
you. Thank you so much.
Swanand Shukla sir want to discuss, I think, with you again. Please, sir. I think by mistake he had done. Okay, no problem. Continue, Radha madam. Please continue your opinion.
Nothing, sir. We are glad that this platform is open for us. Thank you so much for giving us this opportunity.
And you
Thanks a lot.
also helped her for the discussion section. Her laptop was in problem, so you helped
Yes,
her
yes,
while
yes,
given. So
yes.
it's an example of a real mummy, which is with her daughter always. Thank you, thank you.
Thank you so much. Thank you all.
Thank you, sir. Thank you.
Just just wait for formal vote of thanks for from Prashant sir. Okay.
Thank, thank you, sir. Now it's a time to move forward, I vote of thanks. Shri Kumarswami, Mahavidyalaya, District Latur, as we know, organized a world record series 2. Today we have completed 289th day of the long series, and the resource person for today's session who was on the dais for today, Honorable where Madam have talked about the topic that is navigating the world of pediatric physiotherapy. As our principal sir said that the topic was regarding everybody's life, health, even the children's, elders, all those. Now they came across while they get disease. Definitely they go towards the doctor and for the treatment. So where on the topic, Madam have explained all those details, goals of the treatments, then common pediatric impairments that we treat, different types of pediatric physiotherapy treatments. Really, it was very informative session, Madam, too knowledgeable. We don't know, we were not aware about the different kinds of physiotherapy treatment, that is neonatal physiotherapy, orthopedic pediatric physiotherapy, then cardiopulmonary pediatric physiotherapy, common treatment approaches, as well as the principles. And at last you explained that where do we pediatric physiotherapists treat. Now these points you covered very nicely in your lecture. So I'm very, very thankful to you for paying your valuable time, accepting our invitation to deliver a lecture. Thank you so much, Madam. Also thanks to our mummy, Radha Ma'am, who is a daily regular participants who joins the series. So thanks a lot, both of you again. I thank the chief organizer of the series, Honorable Principal M. Ambedkar sir. Also thanks colleagues from my college, Dr. Sanjay Kale sir, Dr. Jambuwant Rao Kadam sir, Honorable Praveen Utge sir, and others. Special thanks to Dr. Swanand Shukla sir and Vidyasagar sir. And I should not forget all those dear participants who join the series regularly. Thanks to you all once again. Now request you please fill the feedback link which is given in the chat box. With the kind permission of the chief organizer, I declare today's session is over. Once again, thank you so much, Vishmitha ma'am, for paying your valuable time. Thank you so much.
Thank you, ma'am. Thank you.
Thank you.